The National Coronavirus Command Council advised Cabinet to make changes to the COVID-19 lockdown level 1 restrictions amid a decline in severe COVID-19 cases as well as hospitalizations. Following a special meeting that was held on Thursday, Cabinet approved their recommendations to lift the curfew and adjust the lockdown level 1. New regulations saw the curfew lifted, alcohol establishments operating under normal licensing rules and gathering capacity increased to 1,000 people indoors and 2,000 people outdoors. Joining us to discuss this and more is health specialist and founder of the Alchemy Health Technologies, Dr. Nthuthuko Bhengu. Doc, thank you so much for your time this morning. Let's first get a sense of what you made of those restrictions lifted just before New Year's Eve.
Thank you very much, Bushe, for inviting me. Good morning to you and to viewers of Newzroom Afrika. No, thank you very much. My view is that these are welcome developments, and looking at them purely from an economic perspective, they certainly are dealing positively with the aspect when we always say it's about lives, striking the balance between saving lives and saving livelihoods. This one certainly is in the saving livelihoods part of the equation, so that's most welcome. Clearly, though, the context, of course, is that the authorities will have had advice from different levels. Of course, the front and center and obvious one is that from health and science experts. There also are economic advisors who clearly would have made a very strong case for this. And of course, we dare not forget about the social partners, because slightly linked to the economic advisors is the issue of making sure that jobs are saved and, of course, to save our industries. And one mustn't forget that this comes right probably when we needed to consider how to compensate for the cases that have come just before this, where travel was restricted, and we know that tourism industry especially faced a very bleak December. So clearly, I do think this is a positive development. I stress to say that purely on economic considerations, because it's not just that. There are other issues that will have been considered. Thank you.
Of course, Doc, the lifting of the lockdown restrictions, and some people have also called for the state of disaster to be scrapped. That's something that's been happening for quite some time, before we even saw the Omicron variant. But that never happened, especially during the deadly Delta variant time. Now that we've seen the Omicron variant, not as destructive as the other variants that we've had coming before us, do you think that this might mean that even if there's another surge in COVID-19 waves or COVID-19 infections, we'll be able to live under lighter restrictions?
Yeah, the thing is that, of course, certainly you're absolutely correct. All indicators seem to suggest that Omicron variant is not as hectic as it were as the other variants we've had. But of course, we don't know what the next variant will be like. So one always has to throw caution about this, even though the general trend over decades, not on Omicron but on other cases, have tended to indicate that the likelihood of the virus getting weaker is one to be considered. But the question about us learning to live with the virus is an absolutely critical one, and I'm glad you raised it, because this is what it's about. We all know now what this entails, what we need to protect ourselves, and we've got a vaccine uptake that is actually disappointing in my opinion. But we do need to start learning to live with the virus. And this goes to a long way in taking us there. Because however you look at the adjustments to the level 1 level now, it doesn't change the fact that people are still responsible for their own decisions. It's easy to say venues must not have more than 1,000 people if they are close, but who's counting? Nobody is. But if you decide to attend that venue, you know nobody wears a mask there, and you know that you are not vaccinated. It's a decision you make it. So we have to start thinking about this, which is actually interesting because the memorandum that was published dated the 23rd of December has been withdrawn, because I see that as the clearest example where the South African scientists are saying we now need to start to learn to live with the virus. When they say quarantine, we need to review and lighten the burden and leave the decision, if you think about it, to the general public to make to a great extent. So yes, you are on the money about us needing to learn to live with the virus.
Just looking a bit back, the COVID-19 pandemic really deals the economy a blow every day. Do you think that the lightening or lifting of restrictions should have perhaps happened a little bit earlier?
I don't think, I can't fault the authorities for waiting this long, because it might seem like Omicron has been around for a long time, but it actually hasn't. So what we now know, thankfully, South Africa has been at the forefront of understanding of this variant. It's actually, even though the announcements about the discovery of this may be a few months old, but the need to understand its patterns, the transmissibility, the severity of the condition it causes, that's relatively new. There are countries that actually will say that maybe have we jumped the gun, but I think the preponderance of evidence we have at the moment, and generally the understanding that in South Africa we probably have a much, much, much higher history of exposure to the virus than is acknowledged formally. And of course, the vaccine, is disappointing as it is, but a lot of people have had it, and I think we've got 15 million fully vaccinated ones based on the latest information. So there is a case to be positive, but I wouldn't blame the authorities for delaying the decision till the time that they made it.
You mentioned jumping the gun. We've seen that quarantine, isolation, contact tracing rules have been relaxed as well in South Africa. Is this government, is this the scientists understanding this virus a little bit better? We've generally followed what we see from the West in terms of lockdown rules and laws, but for the first time, and even though South Africa isn't a highly vaccinated country, but for the first time we see that it seems like the natural immunity that we would have or we would have from the amount of cases that we've had in the country that you mentioned as well as the immunity from at least the one jab of vaccine that most people have taken, is something that they have considered, those in power in particular.
Yes, indeed. It's definitely stated in the circular, and it's a very valid point. This is the reason I say I'm slightly disappointed with how we have come up with what to me looked like largely sensible proposals, and we've now withdrawn it. There are, at least in my view, three main ways that one could run with this, and I think my preferred one is exactly what we are on course to sort of implement, based on that circular, that on basically lightening the restrictions or requirements on tracing, on quarantine and isolation, for example. I do believe that to withdraw that on the basis that there needs to be broader consultation is unfortunate, because we've missed the opportunity to sort of establish ourselves on what was, to me, logical reasoning. And leadership in times like this really cannot be devolved to to the general public. We need very quick responses, and our authorities have got access to world-class scientists. And it's interesting when you see scientists actually proposing a loosening of this. We should have made it much more acceptable. And I believe that the authorities have enough input in that regard to have taken a decision and be firm about it. The next level is that, of course, if you wanted to consult, then consult before you publish the new revised sort of management of the pandemic. And because the risk now is that if after consultation the decision is still to proceed with the sort of amendments, now this is going to be a potential problem from the authority perspective and might undermine trust in the decision-making of the authorities. Given that we are where we are, I would rather not have focused on consultation for new decision, but at least explaining why we've gone ahead with the contents of circular that was dated 23rd of December.
Dr. Bhengu, if I can just very quickly ask you this last question. You mentioned saving lives to saving livelihoods, which of course would have meant that a lot of people would have been out on the streets late, well into the morning on New Year's Day, New Year's morning. Chris Baragwanath, I saw a picture of the emergency room looking vastly different to what it did last year around this time. Do you know the impact in terms of lives that this call has had so far?
Look, the figures, obviously, it's always reporting. It's only the 2nd of January. The department always reports this, and the Department of Transport as well. So that's still going to come. But those pictures tell us that we are back to pre-COVID probably, where trauma around this time is the biggest problem for the country. And the issues that our problems are bigger than COVID. They are bigger than health. It's about our relationship with alcohol and responsibility about driving when you are not sober. And we lead the world, unfortunately, on car crashes, on violence, and all sort of trauma. So the advantages of managing COVID by using levers like sort of restricting movement after certain hours has been that trauma units have been empty around the country. So we are seeing, of course, unfortunately, where we're reverting to our violent society.
Dr. Bhengu, thank you so much for your time this morning. That is Dr. Nthuthuko Bhengu. He's a health sector expert and founder of Alchemy Health Technologies, just unpacking the restrictions being lifted, or at least the restrictions on the curfew in South Africa.